We get injections all the time, for vaccines, for treatments, for just routine checkups. But have you ever actually stopped to think about what makes that simple shot truly safe? Well, today we're going to break down the critical principles that stand between a healing injection and a really serious, life-altering infection. So why is this so important? Honestly, because when the super common procedure goes wrong, the consequences are, well, they're devastating. We're not talking about small mistakes here. We're talking about a genuine, hidden global crisis. And the numbers, they're just staggering.
Just let this number sink in for a second. Every single year, unsafe injections are responsible for an estimated 1.67 million times new hepatitis B infections. And that's not all. On top of that, you've got hundreds of thousands of new hepatitis C and HIV infections. This is a massive and totally ongoing problem.
This really is the definition of a hidden crisis, isn't it? You've got a medical procedure that's supposed to heal, but instead, it's causing immense, life-changing harm. And you know the most frustrating part? The spread of these dangerous pathogens is almost entirely preventable. Okay, so how does this even happen? How does a simple shot go so incredibly wrong? You might be thinking it has to be some kind of complex failure, right? But the truth is, the causes are shockingly simple, and crucially, they are all completely avoidable.
Yeah, see, these are not high-tech, complicated mistakes. These are fundamental breakdowns in basic procedure. We're talking about stuff as simple as reusing a syringe, or giving a shot when a pill would have worked just fine, or just not getting rid of the needle safely. Each one of these is a weak link in a chain of infection that can and absolutely should be broken.
All right, now that we kind of get the problem and what causes it, let's switch gears and talk about the solution. And it all starts with a really clear, really powerful definition from the World Health Organization that basically sets the gold standard for safety.
So check out the 3 pillars of safety here. It's not just about protecting the patient, right? A truly safe injection also has to protect the healthcare provider from any risk, and it has to protect the entire community from dangerous medical waste. It's this complete 360-degree view of what safety really means.
So what does this actually look like in practice? What are the specific, hands-on rules that bring that definition to life? Well, it all starts with the simplest yet most critical action imaginable. It all begins right here. Proper hand hygiene. This is the single most important step in stopping the spread of infection. And it's not just about washing your hands once, As you can see, it's about doing it at these specific, crucial moments to break any possible chain of contamination before it even starts.
But if there is one absolute non-negotiable core principle of safe practice, it is this. A new, sterile, single-use device has to be used for every single procedure. There are no exceptions. This right here is the bedrock of patient safety.
So let's break down the day-to-day rules that prevent disaster. It's a really simple list of do's and don'ts. You always use one needle, one syringe for one patient, and you get rid of it immediately. You never reuse a syringe, even if you swap out the needle, because the barrel itself is contaminated. And you never ever recap a used needle with 2 hands. That's how so many healthcare workers get accidentally stuck. These are simple rules, but they have a life-saving impact.
Really, it all boils down to this simple but incredibly powerful mantra: one needle, one syringe, one time. This is the absolute cornerstone of preventing cross-contamination and, well, upholding the most fundamental promise in all of medicine. First, do no harm.
And finally, let's look at that 3rd pillar of safety, protecting the wider community. This is all about what happens after the injection is given. And believe me, it is just as critical as the procedure itself. You see, a safe injection doesn't end when the needle leaves the skin. The responsibility keeps going. Proper disposal in these sealed, puncture-proof containers is absolutely essential. This one step protects sanitation workers, other health staff, and really anyone in the community from getting accidentally injured or infected by a stray needle.
And this brings us full circle, doesn't it? The duty of care literally extends from the patient's arm all the way to the final, safe disposal of that waste. Every single step in this process is connected, and every single step matters.
Following these simple practices prevents millions of infections and saves countless lives. It's really a shared responsibility. But it all starts with awareness. So the next time you, or maybe someone you care about, gets an injection, you'll know exactly what to look for. Because knowing what makes an injection safe is the first and most powerful step towards making sure you get one.